Hello and welcome to my channel Medic Plus. In this video, we are going to learn about the cubital fossa. So basically, in this video, we will learn two main topic: boundaries of cubital fossa and content of the cubital fossa. And lastly, we will also learn about the applied anatomy of the cubital fossa. So let's get started. First of all, what is the definition of cubital fossa? Cubital fossa, it is a triangular space. It is a triangular space which is situated just in front of the elbow. Okay, so this is the in front of the elbow. We are showing the in front of the elbow. Okay, so imagine this is your arm and this is your forearm. Okay, and this is your hand. So this is the point where this is the place where the elbow joint is situated. So this is the elbow joint here situated. So in the elbow, this is the place which is named as elbow, and in front of the when we see in front of the elbow, we see a triangular hollow space or fossa which is known as cubital fossa. Okay, so first of all, we are going to identify what is the boundary related to. Basically, cuboidal fossa is a triangular hollow-like situation. So it has what? It has apex, it has base which is directed upward, and apex which is directed downward, and it has lateral border and it has medial border. So basically, guys, this is the medial border. Okay, this is the medial border and this is the lateral border. So understand what is the lateral border. Lateral border is first of all, it is formed by what? It is the medial border of lateral border is formed by the medial border of brachioradialis muscle. Brachioradialis muscle. ठीक है, तो मीडियल बॉर्डर किससे बनता है? ब्रैकियोरेडियलिस मसल से. ठीक है, नाउ सॉरी लेटरल बॉर्डर. नाउ मीडियल बॉर्डर इज फाउंड बाय here you can identify that this muscle arises. This is the origin of brachioradialis, and this muscle arises like that and like that. So this is the brachioradialis. Understand? Now lateral medial border is formed by the pronator teres. Pronator teres. Pronator teres arises from the common flexor origin. Understand? This is a flexor muscle, common flexor origin, which is supplied by what? Which is what? Pronator teres. So lateral medial border is formed by what? What border? This. See here. This is the lateral. This is the medial side. This is lateral side. So the lateral side, lateral border of the pronator teres. Lateral border of the pronator teres forms the medial border of cubital fossa. Okay. Now, so finally, we have understand lateral border and medial border. Now we are going to talk about base. So this is the base, guys. This is the base. This, ठीक है, base है. तो this is the medial epicondyle and this is the lateral epicondyle. ठीक है, of humerus. So this is the medial epicondyle and this is the lateral epicondyle. The base is formed by an imaginary line joining the lateral and medial epicondyle. Okay, so this is the base. Now this is the apex. Apex is formed by the meeting point of the lateral and medial boundaries, and lateral boundaries is formed by brachioradialis and medial boundary is formed by the pronator teres. Okay, so we can also say that the apex is formed by the meeting of brachioradialis and pronator teres. Okay, so this is the. Now two more things. It has also a floor. So beneath these are the content. Okay, so these are the content and these contents are carpeted above the floor. Okay, so these are situated above the floor. Now if we remove these, now we can see what the floor how the floor is formed. Understand? So for the understanding purpose, we have removed all these things, all this content, and now we can see now what we can see here, that the brachioradialis and supinator muscles. Okay, now identify where is the cubital fossa. This is the cubital fossa. Line joining the medial and lateral epicondyle forms the base, and line joining the medial and forms the base. Okay, and now this forms the cubital fossa. Okay, now understand. Brachioradialis. Which part of the brachioradialis forms the cubital fossa, floor of the cubital fossa? Brachioradialis, sorry, brachialis, अपर पार्ट, क्यूबाइटल फोसा का अपर पार्ट कौन बना रहा है? फ्लोर का अपर पार्ट कौन बना रहा है? ब्रेकियालिस. ओके, एंड सुपिनेटर, सुपिनेटर फॉर्म्स द लोअर पार्ट ऑफ द cubital fossa. Have you understood? Okay, now here you can also appreciate in the, if you see like this, if you see from the superior view, okay, then you can appreciate here like that. Okay, now basically अब now कि रूफ किससे फॉर्म होता है? रूफ, here we can identify like that, roof is formed here, this is the cubital fossa arm and this. Okay, we are going to so see what is roof. Roof, you can also see roof like where, जहां कहीं भी तुम रह रहे होगे वहां पे तुम्हें रूफ पता चल जाएगा कि क्या है रूफ. ठीक है, ऊपर से जो कवर करता है, तो ऊपर से इसको कवर कौन कर रहा होगा? इस कंटेंट के ऊपर से क्या कवर चल रहा होगा, क्या चल रहा होगा? व्हाट आर द थिंग्स गोइंग अबव दैट कंटेंट? लाइक first of all skin, first of all most superficial you can see skin. If you remove the skin, what you can see? You can see superficial fascia. You can see the superficial fascia. Now superficial fascia lost something important. First of all, veins. Which veins? Cephalic vein, medial cubital vein and basilic vein. Here is the arrangement like that. Cephalic veins like that and basilic vein like that. And cephalic vein and basilic vein are connected by median cubital vein. It is connected by what? Median cubital vein, and it is connected by what? Medial cubital vein. Okay. Now one more thing is here nerves also supplies the what? Supplies the superficial fascia. Now passes the superficial fascia. What loses the superficial? Which nerve loses? The median and lateral cutaneous nerve of forearm also loses the cutaneous median and lateral. On the lateral side, what we can appreciate? This is the lateral side, and this is the, we can appreciate here a nerve. This can be appreciate here a nerve. Okay, like that. And on medial side, what is the name of this nerve? Lateral cutaneous nerve of the forearm. Now we can name what is the name of this nerve? This nerve is known as medial cutaneous nerve of forearm. This nerve is known as medial cutaneous nerve of forearm. Okay, understand? So what is happening here? And also one more thing, next, so after the superficial fascia, if we remove superficial fascia, what you can appreciate here? We can appreciate here a deep fascia. Deep fascia is a thin and whitish appearance. You can see in a dissection, you can see the deep fascia like a whitish appearance. Okay, now so these are the boundaries: lateral boundaries, medial boundaries, base, apex and floor and roof. Understand? So this view you can understand clearly. Understand? Now next is cubital fossa contains four main vertical structures from lateral to medial. Okay, now if we are going to talk about the content of the cubital fossa from medial to lateral, what? From medial to lateral. Okay, here we can discuss here. You can write, I also write down all these things. You can write at last. First, understand what is happening here. So, for the content of the cubital fossa, we are going to, I am going to share a trick like MBBR. What is the meaning of MBBR? What is the meaning of MBBR? So, M means median nerve. First of all, you can appreciate median nerve. First of all, you can appreciate what? Median nerve. Basically, median nerve lifts the fossa by passing between the two head of pronator teres. So, here you can see median nerve. Median nerve. Here you can see the median nerve, and median nerve lifts the fossa by between the two heads of the pronator teres. Here is the pronator teres on the medial side, and two heads of the pronator teres. It lifts the between the two heads of the pronator teres. Okay, you can appreciate in the dissection. Understand? So firstly, you can say that most medial things is the medial nerve. Most medial things. Okay, most medial thing. Now next is B for brachial artery. B for brachial artery. Brachial artery, understand what is brachial artery here. Main thing is most important thing points about the brachial artery, that brachial artery terminates at the level of what? Neck, at the level of neck of the radius. At the level of neck of the radius, it divides into the radial and ulnar arteries. Here you can see, here you can see one more diagram. I should have, no, sorry. So see here, see here this is the radius and this is the ulna, ठीक है। तो यहाँ पे क्या कर रहा है कि नेक के पास में ये क्या हो रहा है, डिवाइड कर रहा है रेडियल और अल्नर आर्टरी में, ठीक है। एक रेडियल आर्टरी चला जा रहा है, ये ऐसे अल्नर, ये ब्रेकियल आर्टरी आ रहा था, ठीक है, ये ब्रेकियल आर्टरी आ रहा था, और ये एक डिवाइड हो रहा है अल्नर आर्टरी में और एक डिवाइड हो रहा है रेडियल आर्टरी में। तो इस तरह से यहाँ पर में ये हमारा क्यूबाइटल फोसा है, यहाँ पर में डिवाइड होता हुआ दिख रहा है, ठीक है। सो B for brachial artery. Next B for tendon. Which tendon? Biceps tendon. Tendon of biceps. ठीक है. Understand? Here it passes in the cubital fossa and finally it attach on the what? Radial tuberosity. It attaches to the radial tuberosity. This is the radial tuberosity. Here it attaches like that. Okay. तो biceps का tendon कहाँ जाके attach होता है? Radial tuberosity पे. Okay. Now, next R. Lastly, R determines what? Radial nerve. So this is the trick. You can appreciate here. Okay. Understand what is the content of cubital fossa from, if we go from medial to lateral side. Okay. So this is the trick. MBVR, you can learn like that. Okay. Now next, last one thing is applied anatomy. In applied anatomy, what we can appreciate here, that, see, first of all, you already have seen in your life that someone has felt your pulse in the cubital fossa, okay, while doing the measuring the blood pressure, understand? So while measuring the blood pressure, brachial pulse is felt in that area, cubital fossa, in the area of cubital fossa, okay. So brachial pulse is the clinical significance. Okay. Now next thing is, I already told about what? Median cubital vein. So medial cubital vein is vein for choice of the what? Intravenous injection. So medial cubital veins is a choice for the intravenous injection. Okay. Next is median cubital vein is a choice for what? Intravenous injection. Okay, I already told about the blood pressure is, universally recorded by auscultating the what? Auscultating which artery? Brachial artery in front of the elbow. Okay, so these all about the anatomy of cubital fossa, and I hope you like the video, and don't forget to subscribe my channel. Have a nice day. We will see you in the next video. Thank you so much.